This is a video about how to work the IV pump before you come to the simulation lab. The first thing you want to do is to get your IV bag and your primary tubing, and you'll need to go ahead and spike and prime your tubing. Something you need to think about in the simulation lab is that we reuse the tubing, and it makes it a little more difficult to prime. So you may have to squeeze the bag to get the tubing to prime. The other thing to keep in mind is these IV pumps do not like bubbles in the tubing. So really look and make sure you don't have air bubbles in your tubing. So on the pump, we're going to come here and we're going to turn it on. We're going to open the door. Now again, we've already got our tubing primed, so we need this little blue slide clamp is how we're going to put it inside the pump. Now, there's two different sides to the side clamp. There's a short end and there's a long end. The short end is what's going to plug into the pump. So when we look on the inside of the pump here, there is a little slot below the red safety clamp. That is where the blue clamp goes. Let me get a hold of it. It plugs in down here. You open the safety clamp, and then you thread the tubing up and around the little track that's inside the pump. Once you do that, you can close the door. Now we need to program the pump. So this is a primary infusion. So this gray button up here says PRI rate. This is the primary rate. So I'm going to push that, and I need to enter in how many mils per hour I want this to run. So my healthcare provider order says to run this at 125 mils an hour. So I'm going to put 125 in the rate. Then I need to go to the button next to it that says PRI VTBI, primary volume to be infused. So this is how much is in my bag. So remember, my bag was here. This is a 500 mil bag. I'm going to enter in here, I'm going to put 450 in here because I don't want to run my bag completely dry. Now at this point I can go ahead and attach it to my patient. So I'm going to come over here to my patient and attach it. And then the next thing that I need to do is push the PRI start button. So I'm going to push start. And you'll see this flashing right there. Okay, I've got an alarm. Read up here at the top, it says occlusion. Well, what did I forget to do? I forgot to undo my roller clamp. When I undo the roller clamp, I'm going to push start again to get my pump to run. So that's how you set up a primary infusion. The next thing I'm going to show you is how to set up a secondary infusion. So if you need to do a piggyback and you want to run a secondary infusion. So I'm going to stop my primary infusion. And now I'm going to get my secondary infusion. So I've got the smaller bag. I need the secondary tubing, which is the shorter tubing. I want to go ahead and prime it. Again, make sure you don't have air bubbles in it. Another key thing to remember when you're priming this tubing is make sure you close the roller clamp before you spike the bag, because otherwise you may lose some of your valuable antibiotic if that's what you're giving. So I'm going to hang it up. I'm going to use the blue plastic thing that holds down my primary infusion, so because I want it to hang lower. I need to attach my tubing to the top port because I want the pump to regulate my secondary infusion. So I'm going to clean off that port. I'm going to attach it right here. And I can go ahead and open my roller clamp now. Okay, what I need to do with the pump is, this is a secondary infusion. So I'm going to push SEC rate, secondary rate. So I need to know, I need to have already calculated what period of time I'd want to run this over. So this is a 100 ml bag that needs to be infused in 30 minutes. So I've done my calculations and figured out that I need to run it at 200 mils an hour to infuse that 100 mils in 30 minutes. So I'm going to put 200 I need to do secondary volume to be infused, the button next to it. Now this one I'm going to enter the exact amount that the bag is. The bag is 100 mils. This is an antibiotic. I want to make sure my patient gets all of their antibiotic. So I've got that plugged in there. And then I need to push the start button that says secondary start. And I push that, I should see the little flashing bar saying that it's running. Now the way this pump will work is that when it hits that 100 mils that's infused, it's going to automatically revert back over to the primary. You don't have to intervene. It will do it on its own. So this is not to try to run 2 infusions at the same time. It's only going to run 1 infusion. So the secondary really should be reserved for those temporary IV piggybacks that you want to use. Now, okay, I'm glad that this came up. I've got an alarm. It says air right here. So what I need to do, the first thing I'm going to do is I'm going to do my roller clamp again because I don't want my patient getting a bolus of fluid. I'm going to open up the pump and I'm going to look right here. Is this pump is sensing that there's some kind of air right in here? So I'm going to slide the safety clamp to the side and push in the blue, do the safety clamp, pull from the bottom. And I can see right here I've got some air in my tubing. So what I need to do is I need to disconnect from my patient, or I need to put in a syringe and pull that air out. Another button important, silence button. So I need to clear that air before I put it back into my pump. Now for the purpose of this, I'm just going to bypass it, but you need to actually disconnect and clear. When I've cleared my air and I've taken care of that, I'm going to put it back into the pump, the small end, thread it up, close it. Now remember, I was running my secondary. If I push this start button, it's going to go back to my primary. So if I'm running the secondary, I need to push the secondary start. And I didn't undo my roller clamp, so you just have to look at the pump and it'll tell you what to do. Undo my roller clamp. There you go. All right, that's it. Thank you.